Antiplatelet drugs. Introduction. An antiplatelet drug, also known as a platelet agglutination inhibitor or platelet aggregation inhibitor, is a member of a class of pharmaceuticals that decrease platelet aggregation and inhibit thrombus formation. Platelet adhesion and aggregation. GP6 and GP1b are platelet receptors that bind to collage and von Willebrand factor, platelets to adhere to the subendothelium of a damaged blood vessel. PAR-1 and PAR-4 are PARs that respond to thrombin, 2A. P2Y1 and P2Y12 are receptors for ADP. When stimulated by agonists, these receptors activate the fibrinogen-binding protein GP2B/3A and COX-1 to promote platelet aggregation and secretion. TXA2 is the major product of COX-1 involved in platelet activation. Prostacyclin, PGI2, synthesized by endothelial cells, inhibits platelet activation. Classification. COX inhibitor, aspirin. PDE inhibitor, dipyridamole. ADP antagonist reversible, COAGULA, ticagrelor. ADP antagonist irreversible, ticlopidi, clopidogrel, prasugrel. GP2A/3B antagonist, abciximab, tirofiba, eptifibatide. PAR antagonist, vorapixar, atipixar. Aspirin, COX inhibitor. Inhibition of COX inhibits thromboxane-2 and prostaglandin I2. Thromboxane-2 inhibition leads to a T-aggregatory effect. Prostaglandin I2 synthesis can be continued as the vessel endothelium has nuclei. Inhibition of thromboxane-2 synthesis causes a T-aggregatory effects. Inhibits thromboxane synthesis and not thromboxane synthesis. Low dose required for antiplatelet action, 40 to 325 mg, dipyridamole, PDE inhibitor. Inhibits phosphodiesterase, breaks down CAMP. Increased CAMP levels and potentiates cyclase. Aggregation. Irreversible ADP, P2Y12, antagonists. Ticlopidi and clopidogrel are prodrugs activated by liver enzyme CYP2 19. Genetic polymorphisms can affect the antiplatelet action. Proton pump inhibitors such as omeprazole inhibits CYP2 19, thus prevent activation of these drugs and resulting in prevention of activation of these drugs. Ticlopidi causes severe utopia and thrombocytopenia and less commonly used. Clopidogrel is better tolerated. Prasugrel is more potent antiplatelet drug compared to ticlopidi and clopidogrel. Avoided in elderly, 75, due to risk of fatal bleeding and those with history of stroke. Reversible ADP, P2Y12, antagonists. Ticagrelor and COAGULA are direct-acting reversible ADP antagonist. Ticagrelor is orally effective as compared to clopidogrel. As compared to clopidogrel, it produces greater and more predictable antiplatelet action. First drug to demonstrate greater reduction in cardiovascular death than clopidogrel in patients with acute coronary syndrome. Recently approved by FDA. COAGULA is intravenous reversible ADP, P2Y12, antagonists. Recently approved as adjunct. GP2B/3A antagonists. Strongest antiplatelet drugs block aggregation induced by all agonists. Abciximab is monoclonal antibody against this receptor and is not antigenic. Eptifibatide and tirofiba are other drugs in this category. Abciximab along with GP2B/3A also inhibits alpha V beta 3 and alpha M beta 2. These actions are responsible for anti-inflammatory and antiproliferative properties of abciximab. Platelet-bound abciximab has long half-life. Eptifibatide and tirofiba are specific for GP2B/3A. In addition to bleeding, thrombocytopenia is the most serious complication of these parents. PAR antagonists. Varipaxar is an orally active inhibitor of thrombin receptors on platelets called protease-activated receptor 1, PAR-1. It has recently been approved as a antiplatelet drug in patients with history of MI or peripheral artery disease. Uses: prophylaxis of MI, aspirin is used most commonly. Cerebrovascular disease, dipyridamole plus warfarin. Artificial heart valves, dipyridamole plus warfarin. Thank you for watching. Please do subscribe.